I want to address a very important issue, and that is how childhood sexual trauma wires the brain to respond for inflammation. And I've got 4 papers with me, and we see that as one of the things that's often going on for some of our most challenging patients with different autoimmune conditions. And so this has been well established, and I've previously referred to the research on the ACE study, which is Adverse Childhood Events and Autoimmune Disease as an Adult, and that was a study with the CDC researchers and Kaiser Permanente Health Group, and putting that together, how childhood traumas are correlated with autoimmune disease as an adult. Now, there's some papers that go even more specific into this that have measured different immune markers. And one is this: effects of childhood psychological trauma on rheumatic diseases. And that talks about that it leads to the etiopathogenesis, or causation of these diseases, or development of these diseases. Another paper, if we can get everything right here, Childhood Maltreatment and Inflammatory Markers, a Systemic Review. This is from a psychiatric journal in Scandinavia. Childhood maltreatment is associated with chronic inflammatory state independent of clinical comorbidities or other factors. Now, another paper, Childhood Sexual Abuse and Indicators of Immune Activity, a Systemic Review. That's from the Frontiers of Psychiatry. Conclusion: childhood sexual abuse is associated with changes in inflammatory marker levels. Now, all these papers are measuring different markers in the blood, like C-reactive protein and different cytokines, and those are immune messengers in the blood. And this paper is real interesting. Immune system changes after sexual abuse in adolescence. So we can see the conclusion: the increase in some immune system parameters and the decrease in several others suggests a dysregulation of the immune system related to trauma in adolescence. Dysregulation of the immune system is known to cause autoimmune and chronic disease. So what they found was that the eosinophil percentage was high. Eosinophils are white blood cells that we typically think of being high when there are parasites or allergens present, but something that the body doesn't want. Well, the body doesn't want a sexual predator as well, and so these eosinophils go high in childhood sexual abuse. They also found that several other changes in CD3 cells, which are a type of cells of other immune cells, were changed and altered. So some things like the eosinophils went high, other markers went low, but the combination relates to a complex interaction with the immune system that leaves it very unbalanced and very unstable. And so we'll see people with some really significant autoimmune diseases have had a history of childhood sexual trauma. And in our office, we deal with that with QNRT, quantum neural reset therapy. And if a person needs counseling, we'll get them to that as well. But counseling is dealing more with the conscious brain. QNRT is dealing with the subconscious brain, where all this wiring toward inflammation is. And so it's very powerful to start unwiring that. And we'll also use neurofeedback, which is brain training with a computer. And then we'll use support for the immune system. And I'm getting dialed in more to different ways we can support the immune system in these complex situations. So that's just information I want to share with you tonight. It may relate for some of you, it may not relate for some of you, but it's very important when we're dealing with autoimmunity and we're dealing with long-term chronic immune dysfunction in the body, or chronically trouble getting over a virus or a bacteria or another infection. And so we've talked in other videos of how that wires from the emotional processing centers into the hypothalamus or control center. That signals the pituitary and then the adrenals and the hormonal system. That hypothalamus also coordinates with the immune system and is listening in constantly on the immune messengers, so it gets directly affected that way. And then the autonomic nervous system gets affected, and we go into fight or flight, and then not enough parasympathetic or rest, digest, and repair activity. So that all becomes unbalanced. And then when we're in too much sympathetic dominance, too much fight or flight, then our thymus can't get rid of the cells that are reacting to ourself. And so all those factors get involved, and they're all wound up with childhood sexual abuse. So if you know somebody with immune problems or autoimmune problems and they have a history of childhood sexual abuse, and you may not know that, of course, but it's very powerful to get them under care and start getting the brain rewired and the immune system rewired so that they can be healthier and live the best life possible. I'm Dr. Michael Winters, Winters Wellness Chiropractic Redefined. Subscribe to us here on YouTube and like us on Facebook.